Well, meanwhile, Gaza's health ministry has declared a polio epidemic across the Strip. The World Health Organization announced on Friday it would be sending 1 million polio vaccines to Gaza after the highly infectious disease was discovered in sewage samples there. Humanitarian agencies have been expressing concerns over an outbreak due to the deteriorating sanitary conditions and the lack of access to health care. Well, let's get more on this with Hind Khoudary. She joins me now on the line from Deir Al Balah in Central Gaza. Hind, as we were saying earlier, we've been hearing these warnings for months now. This is a highly contagious disease that had broadly been eradicated from most parts of the world. Talk us through how bad this could get in Gaza.
Well, it all started with hepatitis A, hepatitis B, diseases, weird stuff on people's skins without knowing what these are. Now, they discovered a highly infectious disease in sewage samples, and later on, they noticed that this was coronavirus CV2 in wastewater, and especially in those areas in Khan and in the middle area. And why in those areas? Because the Israeli forces have been asking all the Palestinians to evacuate from Rafah, from different areas, from the northern areas to the middle area. Palestinians have been living in the streets, in makeshift camps, without having access to bathroom, without having any hygiene, without having easy access to water, sanitation. Sewage is everywhere. Garbage is piled in streets, and this is the least of what health officials are saying. They're saying that this is only a start of a wave of new diseases. Now, the Ministry of Health was unable to track any of those cases. And why? Is because they do not even have the equipment or the tools or the lab supplies to record those cases. And even if someone was affected with this, they won't even have the ability to treat such cases. Now, since Rafah incursion started and the Israeli forces started taking over the Philadelphia corridor, there has been no medical supplies entering the Gaza Strip. There has been no medicines entering, and it's making the health situation collapse every single day. Now, according to health officials, they're not only treating people who are injured from Israeli airstrikes, but they're also treating Palestinians with hepatitis A, hepatitis B, and there's an outbreak of skin diseases among children, especially those who are living in tents. This is only the start, according to the officials, but the ongoing garbage pile, the sewage, people across the streets, shattered across the streets, not even having access to bathrooms is the main reason of why this disease and this virus is spreading across Gaza. And one of the doctors said that this is only the start of the waves of diseases the Gaza Strip is going to face.
Hind Khoudary there with the latest for us, reporting from Deir Al Balah in Central Gaza. Thank you, Hind. Margaret Harris, she's the spokesperson for the World Health Organization. She joins me now from Geneva. Margaret, for more than 25 years, I believe, the Gaza Strip was polio-free. Then just last week, polio was detected in 6 out of 7 routine sewage samples. I mean, we know in war scenarios it creates the environment for polio to spread, but where did it come from?
So basically, it comes from somebody's gut. That's what the sewage samples tell us, that at least quite a few people, because those samples were from Hind and from Deir Al Balah, and it was 6 of 7, as you've correctly reported. So that means that probably more than one person now does have the virus in their gut. And that also tells us that we need to urgently be able to get in there and vaccinate all the children and provide the level of services, the level of care that was the norm in Gaza before this conflict.
Margaret, so there are different strains of polio. I understand this particular strain that's been found is vaccine-derived polio. Can you explain that for us, what that might potentially mean for spread too?
So it's actually a variant that's developed. It originally, a long time ago, was vaccine-derived, but it's managed to get into populations and turn into a variant, just as we saw with COVID. There are many variants, and we have tracked this variant in different parts of the world. And again, wherever we see it pop up, we do a big vaccination response and that usually shuts it down. So that's, again, why the wastewater surveillance is so important. But in this circumstance, and again, we've got a clear way to respond to get the vaccination in there, but we have to have the end of, we have to have the security, we have to have the means of getting the vaccine into Gaza and to the children. A vaccine's no good if it's sitting in a vial or sitting in a truck. So there is an answer, but the answer is we need a ceasefire.
Well, let me ask you, in the event that there isn't a ceasefire, you're saying that you are going to try to roll out 1 million vaccines. What is your plan for access? And if this is this vaccine-derived polio strain, are there implications for what type of vaccine can be used?
Oh, yes, we know what type of vaccine will work. The oral polio vaccine works very well because essentially this is a virus that gets into the gut, goes in, comes out the other end. That's why wastewater is a very important way to detect it. So putting an oral vaccine in does the job. But as you say, the critical thing is being able to reach all the children. Now, we're going to make every effort to do that because we continue to provide that service through the partners, through all the health workers in Gaza who haven't stopped working, as you know. They've done their very best. But just getting around the Strip, just getting to all the children, just bringing the children safely to where they can be vaccinated is almost impossible unless we're given at least a pause in the fighting to do what needs to be done.
Margaret, I understand there has been some vaccination taking place during the course of this war, and there has been some collaboration with the Israeli authorities to ensure that that happens. I was looking at some of the numbers. Before the war, polio vaccination coverage in Gaza was well over 95%. Last year, it was 89%. Those sound like fairly high numbers, yet we are seeing this now. How bad could this get, given the pre-war immunity?
So indeed, you're right. In fact, Gaza was a model. It was one of the best in the region. A shining example of what could be achieved because there was such good primary health care, because there'd been a lot of work to really build that up, a network of good primary health care services. But, you know, I've often spoken with the nurses and doctors who run those primary care health centres. Like the rest of the population, they've had to pick up their things and run so many times. So they're there. And they have continued to vaccinate whenever possible. But again, remember, we're now into the 10th month of this conflict. So that's a whole generation of babies that have been born. You know, the pregnancy is 10 months, 9 months, 10 months. And many of them have not had the opportunity to be vaccinated. So it's not just polio. It's all the other things that protect our children from the diarrheal diseases, the other diseases that in the past killed children. We need to be able to provide that protection.
Of course. Margaret, so far it seems that the cases have been mild and asymptomatic. We haven't been hearing about paralysis, for instance, in the cases of polio. How quickly could that change?
So most polio, 75% of polio may well be asymptomatic. It's like many viruses. The problem is if you are one of those who get the severe form, you can be paralyzed for life or you can die. So that's why it's such an important disease. And we were on the point of eliminating it. The other thing about polio is it's a disease that just stays in the human population. So with vaccination, we could have eliminated it from the world. But with the conflicts breaking out around the world, all that work, all those millions of dollars, all those millions and billions of man and woman hours have been wasted because we've just gone backwards. So indeed, you're right. And at the moment, I mean, the outbreak we're looking at is an outbreak we understand from the wastewater surveillance, which tells us that the virus is there. But at present, we have not had a case of acute paralysis reported to the World Health Organization.
Margaret Harris there, the spokesperson for the World Health Organization, speaking to us there from Geneva. Thank you so much for your time, Margaret, and we wish you all the best with the vaccine rollout.
Thank you so much for hosting me.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.